Former presidential candidate and senator from North Carolina, John Edwards' wife, Elizabeth. Thank you so much for joining us today,
It's great to be with you. Great to be home and with you.
That's right. And so we have to ask, because you are from Orange County and Chapel Hill, what's going on in the Edwards household now?
Well, let's see. We just had 2 tonsillectomies. So there's a lot of ice cream at my house, a lot of children gesturing instead of talking. Actually, they've just come out of it, so it's getting a little bit better. John, when I left the house today, John was meeting with people about the poverty campaign he's involved in. My sister's visiting, which is always great. And it's a lively house with lots going on, but not as much politics as there used to be.
That's right. And a deserved break for both of you, because that's a hard life to lead on the campaign trail.
It is. You know, Republicans or Democrats, you have to give the people credit who are out there all the time, day after day, trying to get their message across. That's exhausting work.
So will we see you out on the campaign trail as a surrogate for Obama, stumping on health care?
Well, I'm going to be talking about health care no matter during this campaign, whether or not Senator Obama asks me to. If Senator Obama asks me to go out and talk about it, I'll be happy to do that. I mean, I think there's such a difference in what the different campaigns are suggesting that it's important to try to make that clear to the American voters, so when they go in, if health care is a big issue to them, they know what it is they're voting for or what it is they're voting against.
Now, he has asked you to advise his campaign, however.
And I have already started talking to some of the people in the campaign about the health care package, the health care messaging a little bit, which is terrific. I'm, you know, as the newcomer in the group, I'm sort of, I keeping my mouth shut maybe a little bit and listening to what's going on. But I was very pleased that those were not empty words, but that I was in fact included in the next discussion that they had.
Well, in fact, you have been very passionate about universal health coverage, especially for people with pre-existing conditions like yourself.
I have. I mean, you know, partly because I sit in rooms where people are waiting to get chemotherapy, some of whom have coverage and some do not. And why in the world our prospects for good health in the end should depend on whether or not our employer has the capacity to pay for our health care, or whether or not, you know, we drew the short straw or the long straw. That should not have any effect on our ability to fight this disease or other diseases, other conditions that that right now are keeping people from getting the health care that they need, because pre-existing condition insurance is pretty expensive to purchase.
So do you feel that it will take a Democrat in the White House to get this done, to get coverage for every single American?
Well, if our choices are as they appear to be between Senator Obama and Senator McCain, there's no question that we have no chance of universal care with Senator McCain. It's not apparently a real goal of his, or it is a stated goal of Senator Obama's. I think that if we want to bring the role of government down as opposed to up, actually, you know, it may seem strange to people, but actually Senator Obama's plan is better. If we want the cost to go down for each of us and still get a good product at the end, Senator Obama's plan is that people are going to need. If you like, frankly, if you like the Blue Cross Blue Shield card or the United Health Care card or whatever card you have in your pocket, if you like it, and if you've got it because your employer helps provide some of your health insurance, you're going to need to be supporting Senator Obama, because Senator McCain actually wants to undo that the employer-based program, and that's going to mean you're going to be out on your own looking for health insurance as opposed to getting it through your employer.
And so many Americans would not be able to afford it as it stands right now, those prices.
Yeah, absolutely. Senator McCain says that he's going to give you a $2,500 tax credit if you're an individual, a $5,000 tax credit if you're a family, to help you pay for your health insurance. It doesn't buy you very much, and that's, you know, he doesn't have any policies that suggest that's likely really to change. My sister is single. She has, you know, some pre-existing conditions, so she'd be getting a $2,500 tax credit. Her health insurance costs over $9,000, and her conditions aren't enormously expensive, but that's just what it costs in the market today. Senator McCain's really, I think, you know, since he's never been in the individual market, doesn't realize what a hurdle this is going to be for so many Americans. And you know, if it comes to pass on day 100 of his presidency, that means if you're in the middle of chemotherapy or you're in the middle of some other long-term treatment, it will be interrupted. You know, Senator McCain's, I think, needs to think through. I hope, you know, what I'd like to do is have my conversation about this, not just with Senator Obama, but also with Senator McCain,
right,
so that we had on the table, no matter who was elected, we would have a program that would protect people who are both in the middle of the treatment or who have pre-existing conditions and are frankly worried about their ability to continue to pay for health care.
And regardless of who's in the White House, is this an issue, a public policy issue that you want as kind of your legacy? Because, I mean, you've been talking about this long before '04.
This is something that matters a great deal to me. And it's something I think I understand, having sort of dealt with it personally, but also thought about it in terms of policy and come in contact with so many people for whom this is an important issue. You know, I call myself a carpool mom, and that is, you know, I'll listen to the radio while I'm waiting carpool, and whatever issue might provoke my attention. So I'm hoping we'll get this solved, and I'll be able to turn my attention to another issue. Another story comes on the news on the radio, and I can get energized about that. But first, we've got to solve this one.
And before we let you go, you know I have to ask: are the Edwards potentially going to move back to D.C.? Do you see your husband being part of Obama's change ticket as a vice presidential candidate, or perhaps in his cabinet as a poverty director?
Well, you know, I'll be perfectly honest. You all know as much. Everybody listening knows as much about this as we know about it. You know, that John's name was mentioned. We read about that. Nobody calls us up and tells us. We don't have some special pipeline where we get to find things out. But we also know that it's best just to keep moving forward to the things that you think are important. So John's already working on poverty. I'm continuing to work on health care, and things will play out as they do.
Great. Thank you for joining us,
It's
Elizabeth.
great. It's great to be with you.